The information and photographs contained in this presentation are the property of Candela and its consulting healthcare providers and are provided for educational and discussion purposes only. By sharing this information, neither Candela nor any of its consulting physicians give you the right to use the information presented. By participating in this masterclass, you agree not to photograph, reproduce, or distribute any of the information or photographs presented during the event. With that, I would like to introduce Dr. Kanika Patel-Shalen, VP of Clinical Operations and Medical Director at Candela, the moderator of this event tonight. Dr. Shalen, the floor is all yours.
Thank you very much, Aviva, and welcome everybody to our webinar today in EMEA. We're very, very excited and we are grateful that you're joining us. We think you're going to really enjoy this special panel that's presenting their experience on Nordlys, and it's really a fantastic device, and you'll see some really wonderful experience. So welcome on behalf of everybody at Candela. Prior to jumping in with our panel, I just want to step back and tell you that it is so important, the Nordlys system, to navigate all the different layers of skin. And we want to show you what it looks like when we use such a multi-application technology that does such a wonderful job across all skin types. Let me pause and talk a little bit about the global aesthetic energy-based device market. It is a very, very exciting market and remains an exciting market despite the times. We know that patients are highly interested in rejuvenation, in appearing as revitalized as they feel. There is a tremendous impact on how appearance impacts overall well-being as well, and that is something that is a trend globally. We see here that the energy-based device market by region is actually quite large, with the largest market currently being in North America, but other markets catching up, and the European market is quite large as well at 26.52%. So let's focus a little bit on how Nordlys can really help provide solutions that deliver on this market, because this market is increasingly diverse, both male and female, across the board with ages. So there's a growing focus on prejuvenation and prevention, also a wide range of skin colors and ethnicities. And also there's increased awareness among all those patients that we just talked about the types of possibilities to anti-age, and also how energy-based devices in particular can help with rejuvenation in a very natural way, and can also help maintain the health of the skin. So there's quite a variety here, and there's certainly more acceptance across the board and a normalization of cosmetic procedures. The Nordlys offers a very important solution because it is able to treat across that range of patients that we just talked about. There's some very particular technical pieces of this device that really make it stand out. The SWT you'll hear us talk about is the selective wavelength technology. It is a type of IPL technology, but rather than being purely broadband, it's actually the opposite of broadband. It's more laser-like because it takes the most important wavelengths and narrows them so that the correct wavelengths for the target that's being chosen are being utilized in the skin without excessive energy that can potentially cause unwanted side effects. So this narrow band is focused, it eliminates unnecessary excess bulk heating, and these laser-like energy settings are really the result, gives us the result that is much more efficacious and certainly safe in our patients. It especially is important when we are treating vascular lesions, because we have certain wavelengths that we're really trying to address with vascular lesions. Those wavelengths can be in the 532 range. The big range is really the 595 range. And then there's also the 755 range. And that PR applicator covers all of those ranges with quite a focus around 595, which, as many of you who may know the V-beam know just how important that wavelength is in treating vascularity. In addition, treating vessels requires very short pulse durations to do it properly. And the Nordlys is the only system that's able to provide pulse durations under 1 millisecond with treatment energies that are efficacious still. So that's important. Additionally, the platform has two non-ablative fractional applicators. The wavelengths are 1940, which has a very high water absorption, and 1550. And the combination of those two, you'll hear more, is certainly quite efficacious for skin rejuvenation, for treatment of pigmentation. And then the third piece of the device is the ND-YAG, which is a wonderful ND-YAG, which completes the vascular portion of the platform. I use it quite a lot in periocular vessels. The Light and Bright treatment solution for rejuvenation is one of the highlighted treatments in my practice. Patients absolutely love it. You can make it more intense or less intense depending on the patient's downtime. And you'll hear much, much more about it as we move along in the webinar, but it really is fantastic. So I'd like to have you meet the panel. We're really, really pleased to have all 5 of you joining us and excited to turn it over to you. We'll begin this evening with Diala Haikal from Paris, who is going to speak to us about various types of rejuvenation. Then we have Dr. Jelena Jeftic, who is from Belgrade. She is a dermatologist based in Belgrade and has a tremendous experience with Nordlys, amongst other devices. And she'll be talking to us about some of the vascular work that she does and the pigmentation work, and with some very nice dermoscopy photos as well that accompany it. After that, we have Professor Firaz Al-Niami, who is a UK dermatologist as well, which he's a highly published author. Many of you who are in the field will recognize him. And he has extensive experience. He has over 230 scientific publications and has been the winner of the Global Excellence Award for the Consulted Dermatologist of the Year twice. We will then go to Dr. Cordula Arnaud Frank, who is based in beautiful Mallorca, Spain, and runs a phenomenal practice called My Skin in Mallorca. She treats all skin types all year round with a variety of devices, but is really doing some really wonderful work with Nordlys and also some medical dermatologic work with Nordlys with acne patients. She is also very highly regarded and highly published in her field. And finally, we'll have Nicola Dermac, who we're very, very excited. He's based in Italy and also a dermatologist. He is a Candela Center of Excellence and has also tremendous experience with many, many different devices. But his work, especially with the non-ablative fractional devices, in conjunction with the other applicators on the Nordlys, is really spectacular. So very excited to see Dr. Dermac's work as well. So without further ado, you've met the panel, and I'll turn it over now to Dr. Diala Haikal.
Hi, everyone. Can you hear me?
Yes.
Okay, perfect. So thank you, Candela, for having me today. I'm very excited to join this special panel. Today, we will be talking about the prejuvenation trend and the treatment with EBDs. So up until the early 2000s, aging skin was treated when first visible wrinkles were appeared for Gen X and millennials. But now with Gen Z, we talk about prejuvenation, which is a portmanteau of prevention and rejuvenation. It addresses Gen Z between their 20s and 30s to look refreshed with a glowy skin, with firmness and an even tone, to have the best version of themselves with natural results. To improve the skin texture, tone, evenness, glow, and appearance, we will use non-invasive procedures with preventative fillers, neurotoxins, EBDs, and anti-aging cosmetics. Let's dive deep into some of my clinical cases, and I'm starting with this looking for a useful and radiant skin. And after 3 sessions with a dual Frax 1550 and PR 530, we have her skin appears smoother with a fresh, revitalized skin. So we improve the overall skin texture. and she was very happy and satisfied. Let's move to this other patient who was also seeking to reduce her pores and achieve an even skin tone. And after one session of a dual Frax 1550 PR 530, we can notice that her skin is useful with natural looking appearance, and she was also very satisfied about the result. Now, for this other patient who was seeking treatment for his acne scars and aiming for more useful appearance, after 2 sessions of a dual Frax 1550 and Nd:YAG micropulse 1 month apart, we reduced his acne scars, and we can see that his skin is much better, and he looks very happy and with natural looking enhancement. We can see that all his acne scars were mitigated and reduced, and he has a glowier face. For this lady, she was looking to improve her pigmentation because she had a full face of pigmented lesions. So after a triple Frax 1940 Nd:YAG micropulse combined to a topical cosmetics vitamin C, after 2 sessions, we had a beautiful improvement with a drastic reduction of her pigmented lesions. And she was very satisfied as well. For this patient, we also have a dual Frax 1550 Nd:YAG micropulse, and after 2 sessions, we have a beautiful result by reducing her enlarged pores, and she also have a glowier face and radiant skin with an even tone. The same for this lady. She was looking to improve to reduce her large pores and to have a glowier face and radiant skin. And after 3 sessions dual Frax 1550 and Nd:YAG micropulse, we achieved a beautiful result with a glowier face and a natural looking appearance. The same for this last lady. After 2 sessions of Frax 1550, we also improved and achieved a glowier face and radiant skin. For further information about prejuvenation, don't hesitate to check out on my latest publications. Here is one of them published with Open Access and Aesthetic Surgery Journal. Otherwise, we have also published several publications in several languages across various countries on prejuvenation. On the other part of this presentation, I will also share my experience about lip augmentation and perioral rejuvenation with the non-ablative fractional laser Frax 1550. As we know that the perioral and oral regions are subject of beauty criteria, and we look for a rejuvenation of these areas with a myriad of different treatments using fillers, threads, collagen, even surgery. And fractional lasers are known to increase the production of elastin and collagen that could promote and improve facial imperfections, enhance perioral rejuvenation and lip augmentation, and thus achieve a natural useful appearance. So how could our non-ablative fractional laser Frax 1550 improve this perioral and oral appearance? For this, I will share, as I said, one of my clinical studies done in my clinic, including 20 patients. In this study, we did 3 sessions of treatment, 1 month apart. and we use several settings depending on the clinical examination and the skin phototype. Before the treatment, we prepared the patient with an anesthetic cream 1 hour prior to the treatment, and we explained the process of the treatment to every patient. So let's go over some of these results. For example, for these young patients, the first one, she was looking to have fuller, more useful looking lips and natural looking enhancement. So after 2 sessions with Frax 1550, treating the oral and perioral area, we achieved these beautiful results, maintaining this balance with the rest of the facial features. And we improved the overall shape and the contour of the lips. So she was very happy with these results. The second patient refused to have any filler treatment, so we suggest a EBD treatment with Frax 1550, and she was also very satisfied. She now has fuller lips with useful appearance, and we also maintain this natural balance with the other facial features. For this elder lady, she was looking to enhance the perioral region, reducing her nasolabial folds, her marionette lines, and improving the lip texture as well. So after 3 sessions of Frax 1550, we could improve the texture of her lips. We reduce the nasolabial folds and her marionette lines, and she looks more happy and youthful. For these ladies, they were looking to hydrated lips, and after 2 sessions, 1 month apart with these settings, we also achieved very good results with natural and fuller lips, and they were very satisfied and very happy. To go in details within this study, with Candela, we published this clinical study in a clinical bulletin. So please don't hesitate to check out on this publication, talking about this treatment and the enhancement that we could have on natural perioral and oral rejuvenation with Frax 1550. So in conclusion, to sum up, this treatment with using this wavelength 1550 provides a natural looking outcome either for lip rejuvenation or face rejuvenation with minimal invasive procedure, efficient results, and we have the patient satisfaction and physician satisfaction as well. We have measured these scales with validated scales, and it shows that it's a very cost-effective solution. So thank you for your attention. If you have a question, don't hesitate to share your questions with us on that chat within the Q&A session. Thank you.
Thank you, Dr. Diala. That was beautiful photos and very nice explanation. We had a question about skin types 5s and 6s with Frax, and I know that you have a population that has a lot of different skin types. Can you talk a little bit about how you utilize that in darker skin types, the Frax?
Yes, so thank you for the question. I also use the Frax 1550 on darker skin tones, and I actually have written a publication about this that should be published soon with Candela. So I always manage the treatment by preparing my patients before the treatment process. And I also use mild settings for the treatment on darker skin tones. And after the procedure, I always check and follow my patient to avoid any complication and side effects.
Is there anybody else from the panel who wants to comment on treatment of non-ablative fractional and darker skin types?
Yeah, hi, Kanika.
Hi there.
So again, yeah, I have a lot of experience with higher skin types, including skin type 6, so black Afro-Caribbean skin. The key is the density, really, because from the studies, we know that the risk of post-inflammatory hyperpigmentation is significantly higher with a higher density rather than just the fluence. So with the milder settings, even though you might want to cut down on the fluence, the key parameter to bear in mind will be the density. So the trick will be to use the wider scanner, and I'm going to talk about that. So going up to 12 millimeter, use a lower density, maybe just cool in between, and use longer intervals between treatment sessions. But even in a skin type 6, it's safe.
That sounds wonderful. Yes.
I would like to, if I can answer also.
Of course. Thank you, Nicolas.
Okay.
Dr.
From my experience, I live in South Italy, which means all patients are phototype 4 when we are happy, and there is a lot of sun. So there is always always the problem of tanned skin. So with Frax 1550, we have to be careful during the really summer period and in really dark skin types. But with Frax 9040, the problems with PIH or pigmentations after treatments, etc., it doesn't occur at all. So just to give you an idea, we are working almost all year with Frax 9040. So 9040 is really extremely safe when we speak about post-inflammatory pigmentation, and much safer than 1550.
And I know you too, Dr. Cordula, you're also in a sunny climate all year long and have that same experience, I think. Just on mute.
Sorry, yes, hello. So I totally agree with Nicola. We also use 1940 all year long, even if the skin is a little bit tanned, there's no problem. But with 1550, I would be rather careful. So we use more the Pico in the summer.
Very good advice. Well, wonderful. We'll move along, and Dr. Yeftik, we're excited to see your experience as well.
Thank you, Konica. Good evening to everyone. So let's start talking about my favorite topic, vascular lesions. Okay, so I suppose everyone are familiar with this slide, but this graphic illustrates the depth of penetration of selected wavelengths. So all the factors or parameters are being equal. So note that the pulse dye laser has less depth of penetration than the Nd:YAG wavelength. So given the same energy and the spot size. So the Nd:YAG is used to penetrate deeper into the dermis in order to destroy deeper structures such as hair follicle and deep vessels. So this graphic is more focused on the Nordlys device and the wavelengths of his handpieces. So we see how versatile and multifunctional Nordlys is. And also I would like to mention that we have 24 cleared FDA indications. So Candela can offer 3 different devices for treating vascular lesions, and all are exceptional. So today we will just focus on the Nordlys device. So we divided vascular lesions into primary and non-primary ones. We will start from the rosacea. If you run a busy business and you're working as a dermatologist, you will see rosacea every day. We classified it into 4 clinical subtypes. And we have a wide range of treatments, even topical and oral treatments, but nowadays the more efficacious one are vascular treatments. So in this case, this is a young male. He came with erythemotelangiectatic type of rosacea. So we started with the VL handpieces because of his skin type. And then after we transferred to a PR handpiece. So the second photo is him after only 3 sessions, and we always recommend maintenance treatment. So the third photo is 6 months after his third laser session. Every day I'm using dermoscopy, so it really helps me to navigate the treatment and also the settings. So as we can see on the first photo, we see on dermoscopy a lot of erythema and a lot of telangiectasis, and on the last photo we see just only slightly erythema. So I also want to mention that this type of patient didn't receive any type of oral or topical medications. So this is also a very nice case with rosacea, erythemotelangiectatic type, and also we follow it on dermoscopy. So we see a beautiful reduction of redness only after 3 treatments. This is the same patient. So I would like also to mention that I'm usually combining different settings. If I see telangiectasis, I always treat them first, and then I use the settings for rosacea. Okay, so this is the same patient as well. And this is also very common. Usually we see it with rosacea, but sometimes it can happen just as the dermatosis alone. We see only after 1 treatment that we have a beautiful anti-inflammatory effect on demodicosis. And this is one of the, let's say, hardest patients to treat because she had melasma, she had solar lentiginous, rosacea, and telangiectasis. So in her case, we perform in the upper part of the cheek PR handpieces with the facial telangiectasis and rosacea settings, and in the lower part, we perform NDAG, and this is her only after 1 session. This is something that you will see also very often in the clinical practice. So as you can see, the energy is very low. You can achieve very nice results with this energy, but you can also go higher. So this is only after 1 session. Also, when we follow it on dermoscopy, immediately after, that is second photo, we see erythema and slightly edema. The third photo is 1 month after the only 1 laser session. As we can see on dermoscopy, that is totally clearance. So also facial telangiectasis we see every day in our clinical practice. So we can use our selective wave-band technology, IPL handpieces or NDAG handpiece. I have to say that the NDAG on the Nordlys is definitely one of my favorite handpieces. As we can see here, nasal telangiectasis is only after 1 treatment. So in her case, we combined VL and the PR in the first session, and in the second session, all the resistant veins we treated with the NDAG, and this is beautiful result only after 2 sessions. This is also nasal telangiectasis, and also very nice when we see it on dermoscopy. Okay, so this is a video, how it looks. As you can see, treatment is not painful. Also, we have a cooling from the NDAG handpiece. You can add some external cooling if you want, but usually this one is enough. Okay. Let's go to another slide. Okay, so this is very young male patient. He came complaining about his dark under eye circles. And after the clinical examination, we agreed that dark circles are caused by these periorbital veins. So we decided to use Nd:YAG, and I would like just to highlight that if you're not comfortable or well-trained, with this type of procedure, maybe just wait a little bit because you have to really be confident in treating this type of lesions. Okay, let's see the video, how it looks before. And this is how it looking now after only one session. As you can see, we have a complete clearance of periorbital veins. Okay, so why you have to be very cautious when using Nd:YAG on the face? Because you can get some atrophic scars, so please be careful. And yes, using Nd:YAG on the body and treating telangiectasis is one of my favorite procedures. And you will see it in video how it just looks. Yes, very nice. Also, I like to follow it on dermoscopy. So in the one group of patients, we have immediately after the treatment, some slightly erythema and edema. And this is also one short video. Immediately after, you see just the clearance. So it's not a painful procedure, but it's just, let's say, slightly uncomfortable. Okay, so let's move to port wine stains. So everyone who ever treated port wine stains, especially in adult patients, know how hard it can be. So port wine stains are capillary malformations that involve primarily metasuperficial dermis. And let's start from this patient. This patient is 45 years old, and she underwent numerous laser procedures before she came to my office. And in her case, we started combining VL and the PR handpieces, and this is a very, very nice result after the 6 treatments. So usually we also say to patient who has port wine stain that they have to come to the maintenance treatment. And this is also a very nice case. This is, we see a very much prominent asymmetry of the face with the people who has a port wine stain. So only after one treatment, we see how less asymmetry also in the especially in the angle of the mouth. And this is also a patient who underwent numerous procedures. She has a lot of atrophic scars on her port wine stain. And when we look at the dermoscopy, we see some vascular lacunas. And after 3 treatments, we see just erythema. And of course, we will continue treating her. And especially now after 3 treatments, we have a very nice and satisfying result. This is a nice published data. And for me, it was very much interesting because they followed the patient from the childhood to the adulthood. And they wanted to show how is the progression of the port wine stain and how important it is to treat the patient in an early stage of port wine stain. So this is also a young male with a hemangioma, and with the 3 sessions combining VL and the PR handpieces, we reduced a lot of erythema, the telangiectasis as well, and the surface of the hemangioma was very much less than before. When we look at on dermoscopy, we see a nice reduction of telangiectasis. And this is also a 50 years old female with a hemangioma. As we can see on the first photo, we see just a clearly edge of the hemangioma, and this is her after only 4 treatments. When we see it on dermoscopy, we will also see beautiful reduction of erythema and telangiectasis. And of course, in the sunny countries, we have a lot of actinic damage. And this is one of nice cases. We treated her in the middle of the summer with a high protection of SPF. And in the 3 sessions, we clearly changed the whole area of her face and the skin. So in every session, we combine it, VL and the PR handpieces. And in the 3rd sessions, because she had a lot of telangiectasis, we treated with the NDAG and completely cleared her skin. So this is her also on the other side. And this is how she looks. And this is also a type of telangiectatic damage. We see it usually in the lateral side of the face with the solar lentiginous, redness, and telangiectasis. And this is also a nice case. If you are doing a lot of injectables, you can use Nordlys for hematoma. It's only after 1 session. And this is also very, very hard case of acne conglobata. This girl was treated with a high dose of isotretinoin. And this is her after residual redness. So only after 2 sessions, we made a really big difference in her redness and telangiectasis as well. Okay, so this is also a nice case. This man used topical corticosteroids for 3 years continuously. So as we see on dermoscopy, we see a lot of erythema and a lot of telangiectasis, and this is him only after 1 session. It's beautiful when you see it really on dermoscopy, how we made the clearance only with the 1 treatment. And of course, this is something that is also very common in dermatological praxis, viral warts. I have to say that this treatment is not so comfortable, but definitely it takes only 1 session to make total clearance of viral warts. And this is how it looks only after 1. Okay, thank you so much. If you have any questions, please ask.
Thank you, Yelena. That was fantastic. So many cases. I love all of your experience. Just before we move on to Dr. Al-Niami, a couple of questions. Can you talk a little bit about how you use it for bruising? Do you use the PR applicator or do you use the VL applicator? And how do you set the parameters?
Well, it depends on the skin type. You can start for the VL and then transfer to the PR, but usually it just takes one session. So you can go for the rosacea or photo rejuvenation settings, and that's it.
Great, and you base it on the skin type with the rejuvenation or rosacea.
Yes.
So a split pulse as opposed to a single pulse.
Yeah.
Wonderful.
Double. Yes.
Yes. Wonderful. And I know we talked a little bit about your patients in the summertime, and I wanted to ask Nicola and Cordula also to just comment a little bit about how do you approach your patients, because you're in such sunny climates. It's almost summer half the year where you are, and also you have some darker skin types. So let's take a moment, if you don't mind, and talk to the audience a little bit about how you keep your practices going safely during the summer months.
Corda, go first.
Okay. So for me, it's always important, of course, that patients use SPF 50 all the time. So all year long. Yeah, this is number one. Number two is that they should not be pre-tanned too much. So if I see them, if the skin is too pre-tanned, then I'm very careful with IPL. I still work with 1940. We work with Pico all year long, but we need to be a lot more careful with the PR 530 because you can easily burn the skin.
Yes, basically, all treatments that we do are not, they are not causing an inflammatory condition. I mean, when you live in this part of the world with such a nice weather and temperatures, you cannot use the treatments which are followed by huge or long erythema. So all our treatments are normally safe. So I used to say to my patients, look, we can work until 15 days before sun. It is important not to come here tanned. So we stopped the work very late, almost in July, but we begin to work, we can say like that, in October, November. During the summer period, of course, we continue to do hair removal, example, with NDYAG, with Gentle Max. So we switched from Alexandrite to Gentle YAG, of course. With skin treatment, the people couldn't take lots of sun. We continue to work with 9040. With Pico also we can play, but it is very important not to be very tanned and just to wait until they lose the tan.
Yes, thank you. In Florida, we have a similar experience. It's very, very hot, very sunny, and I think I base it also depending on the skin type and their underlying condition. So if they're prone to melasma or they're a darker skin type with more risk with hyperpigmentation, we're careful, more careful in the very hottest months. But with our lighter skin patients, many of them, we're in such heat that our summer months, curiously, sometimes are not so bad because patients don't want to be in the middle of the sun all day long. So if we can see that they're quite good about sun protection and their skin really doesn't seem to be soaking the sun, then we will, with sunscreen and with a hat, go ahead and treat patients all year round. So it really depends individually on the patient, their ability to care and stay away from the sun. But you always have some passive exposure, even when you're running to the grocery store, sitting and having a coffee like you all do in Europe outside. So a couple of questions before we go to Dr. Al-Niami. Does anybody in the group have experience using it on keratosis pilaris?
Using
yeah, Dr. Diala. Oh,
microphone.
You just got mute. Yep.
Yeah. So about keratosis pilaris. Actually, with Firas, we are writing a publication about this, about our experience using NDYAG micropulse in treating keratosis pilaris. So please keep your eyes open.
Yeah, I mean, obviously, it's not, sorry, Konika, it's not with this handpiece. This is why, I didn't answer this question. So it's with the Gentle Max, with the NDYAG handpiece with the microsecond, but not with the Nordlys platform.
And I've used it with the PR 530 actually, with some success. So you can use the PR 530 I tend to use it in the expert mode with 6 millisecond, somewhere between 3 milliseconds and 6 milliseconds, and then a single pulse, so not split pulse, to get a very small amount of purpura on the arm. You increase the energy levels until you get to that number. So if you're using a 3 millisecond pulse duration, then you're in the 6 joule range.
You mean 6 milliseconds, 6 joule, or did you mean 1.5 milliseconds, 6 joule?
Nope, 3 milliseconds. 3 milliseconds,
Yeah, 3 milliseconds.
6 joules. Yeah.
Yeah.
The only other
thing I wanted to add about there seem to be quite a few questions about higher skin types and tanning and safety. The only other thing we'll add in is what Candela always says, and it's in the protocol for Candela treatments, is if in doubt, perform a test batch treatment and follow up the patient. So you don't have to treat on the day. If there's any doubt, you can always perform a test batch.
Absolutely. And we'll turn it over to you now.
Okay, well, thank you. So thank you. Good evening, everyone, and good afternoon for those who are in the United States. So my colleagues have already done wonderful presentations talking about the Nordlys platform, the IPL handpieces, and Dr. Dayal already mentioned about the 1550. So I'm going to just share my experience why I believe that these two handpieces are brilliant handpieces to have in practice. So before we talk about the two handpieces, let's just step back and talk a little bit about physics. So these are two non-ablative fractional handpieces. The 1550 corresponds to the wavelength 1550, and the 1940 corresponds to the wavelength of 1940. So if we just forget for a moment the hemoglobin and melanin, if we look at the blue curve here, that is the water absorption. So you can see beyond 1200 nanometer, there's hardly any melanin and hemoglobin absorption. So we start to have water absorption. Now, when we get closer to 2000 nanometer, the water absorption is very high and it becomes ablative. So there is a difference in terms of how the tissue interacts with these two wavelengths. So the 1550, because it has relative lower water absorption compared to the 1940, the profile histologically is very different. And you can see that here in this slide. And this is histology slide from Candela, and this is why it's very important when you approach or deal with non-ablative fractional handpieces. It's always good to ask for the histology. So what you see on the left-hand side, you see the histology from a 1550. So this is a wavelength that is absorbed by water, which 60 to 70% of the skin is composed of water. But because of its relative low water absorption affinity, you can see it penetrates deep. So this wavelength is ideally suited for anything that is in the dermis, such as scars, rejuvenation, stretch marks. Whereas on the other hand, if you look on the right-hand side, you see with the Frax 1940, you see because of the relative higher water absorption, so most of that wavelength is just going to be absorbed as soon as it hits the skin. And this is why there is relative less amount of that light penetrating deep. The effect is more superficial, which means tone, texture, more of the epidermis. And this is why it's one of my favorite wavelengths, because it really gives a glow, it gives a nice texture and smooth of the skin. So the 1940, superficial, the 1550, deep effect. So what does that mean in clinical practice? In clinical practice, if you're working on the surface of the skin, tone, texture, glow, the makeup sitting nicely, you would need the 1940. Whereas if you're looking at scars, pores, stretch marks, you're looking at more the dermal remodeling, then you need the 1550, and it becomes then apparent why we need really both wavelengths. Now, there's one thing important I would like to mention here, and this comes often from questions when I give talks about this. Some think that if they use the 1550 at low fluence, that they might be a bit more superficial. It doesn't work that way. So even with the lowest fluence of the 1550, you start very much in the mid-dermis, and that is because the wavelength's affinity to water is very different from 1940. And even with the highest fluence of the 1940, you are still relatively superficial in the epidermis. So you cannot cheat. You cannot say, I'll have the 1550, use low fluence, and I'm more superficial. It doesn't work that way. These are two different wavelengths with two different interaction profiles in the skin. Now, one of the great things about this handpiece, really, which differentiates it from any other non-ablative fractional handpiece that we have in the market, is you have the handpiece, but you have the scanner within the handpiece. And what you can see here is you are able to dictate the width of the scanner. So we can go and choose for a very narrow scanner width, like on the right-hand side, so that's 4 millimeter, and that's very useful when you're treating, for example, small discrete areas or surgical scars or thin, narrow stretch marks. And on the other hand, if you are treating a larger zone of area, you can use the 12 millimeter scanner width. But it's not just customization in terms of the scanner width. If you look carefully at the 4 millimeter, you see these columns. These columns represent columns of coagulation in the skin. They come a bit closer together, which means that the impact and the density is a little bit higher with the narrow scanner width. And this is what we already talked about. If you have, for example, a very higher skin type and you want to be a little bit more gentle, it's better to use a wider scanner width and reduce the density so you don't have these columns coming too close together and building up heat. On the other hand, if you have, for example, a very atrophic scar on a light skin type patient and you really want to get a lot of heat there for contraction, then it's better to use a narrow scanner width and then increase the density. So you really are, with experience, able to adjust the scanner width, and this is a great feature of this handpiece, which truly differentiates it from all the other handpieces in the market. So let's look at some patients. So this is acne scar, and as you can see, this is a higher skin type. London is the most diverse city on earth, so we have all skin types from 1 to 6. A trick here that I like to use the 1550. I like to start with a 4 or a 6 millimeter scanner width. So that is a narrow scanner width, doing 2 to 3 passes on the individual scars, really making sure that I get some edema, coagulation at the base of the scar, and then I finish off with a 12 millimeter scanner width, lower density, treating the entire cheek. So it's targeted treatment for the individual scar with a narrow scanner width, few passes, followed by a pan-facial treatment with a wider scanner width, but with lower density. Even pores, you can see here clearly that the pores are tighter and nicer. You can also treat the pores with the 1940, but even with the 1550, with low fluence, you can also get nice improvements. You may get some edema in terms of the downtime. And again, this is not necessarily something that has to be done with the Frax Pro alone. It can also be combined with some other interventions. So sometimes for the very oily skin with the pores, I like to do, albeit off-label, intradermal botulinum toxin together with the Frax. But you can see the take-home message here is that the Frax works beautiful in tightening of the pores. Stretch marks here, you can use, again, narrow scanner width to treat the stretch marks, and you can combine that, for example, with the PR handpiece for the erythema or the V-beam, if that is the device that you have. Now, obviously, this is a skin type 6, as you can see, and I do treat many patients with skin type 5 and 6. This is a hypertrophic keloidal scar injected with a mixture of hyaluronidase and steroid, but had some Frax for remodeling of the scar and also for delivery of cosmeceuticals with tranexamic acid. This is one thing I like to do, particularly on the higher skin types, to reduce the pigmentation and post-inflammatory hyperpigmentation that ensues from many of these conditions. Here you can see, again, very beautiful, the combination of the PR handpiece to treat the vascular components and the Frax, the non-ablative fractional handpiece, to treat the scars. So you can safely use the combination of these two handpieces. We use the IPL handpiece first. So the PR is one of the IPL handpieces that already Dr. Konika mentioned, is the gold standard for vascular and the lighter skin types. And then immediately afterwards, you can use the Frax 1550. So if you have a scar with a vascular component, you can start with the IPL handpiece, followed by the Frax 1550. This is from a colleague in Ecuador who I know well and has amazing results using the combination of the handpieces for acne and acne scars. really the take-home message here is that there is a shift in how we practice, where we no longer want to just clear the entire acne and then wait before we start treating the acne scars. As we treat the acne at the early stages of the macular erythema, the macular stage of scars, we start with low energy, low fluence of 1550, and that can help too. So even introducing the 1550 at halfway through the treatment of acne has also been shown to delay and prevent acne scarring from forming. In terms of the 1940, one of the other things that differentiates it from one of the other wavelengths that's in the market, which is the 1927, in that the peak for water absorption is at 1935. So if you look at the wavelength and you compare the 1940 compared to the 27, we are much closer to the 1935 compared to the 1927. And this is why this wavelength performs superior to the 1927, which I also have a lot of experience with. Right, so why is the Frax 1940 one of the workhorse handpieces for me, and why do patients love it? And I think that's the most important thing, because as a doctor, you might have a favorite, but more importantly is what the patients want. Now, if you look at what makes skin beautiful, what is the ideal beautiful skin? That is what everyone is seeking for, which is smooth skin with a nice glow, nice light reflection, even tone, no redness and pigments and blemishes. And for those who apply makeup, the makeup sits nicely. That is also something that you can ask your patients. So if you look at Sharon, this is one of the patients, one of the first patients who had the Frax 1940, and she only had the Frax 1940 because she wanted to see what this wavelength does. And what you see is not just clearance of the superficial pigment, because remember, the Frax 1940 is going to microscopically renew the epidermis. So where you have pigmented keratinocytes in the epidermis, that pigment is going to just clear over time. So you have this pigment-free new skin, but the skin is smooth. The skin has a glow. The skin feels very nice. There's something about the tactile element of the skin that patients really like. And more importantly, the patients have received many positive compliments. So why is that? Why is the skin glowing, and why is she receiving many compliments? The same here. If you look at this patient, if you actually look at the jowls, the patient came here to address the jowls, and she did have a treatment to address the jowls, but at the same time, I offered the Frax 1940, and she's actually totally in awe and in love with the new skin, because you can see the quality of the skin is improved. And I think this is important. We don't always necessarily have to talk about a scar or a pore. We can just talk about the quality of the skin is improved, and this is objectively seen here with smoothing of the skin with a nice glow. One of the other things that is common in higher skin types, particularly skin type 5 and 6, is this discoloration and pigmentation of the lips. And this is essentially just increased pigmentation over time because of sun exposure, but also their skin color predisposed them to this. So this is also a nice light treatment that can be done to lighten the lips. So it's just all the different possibilities that one can have in using this unique wavelength. Also in pigmentation as a cosmeceutical delivery, because we know, if you remember the slide, the histology slide that I showed you about the Frax 1940, where you have these superficial microscopic cracks in the epidermis, which means that anything that you apply on the skin afterwards is more likely to be absorbed, and this has been shown by studies as well. So in this case, for example, I like to combine that with topical tranexamic acid, topical antioxidants, so that's doing the Frax 1940. If you want, you can also, depending on the type of treatments, proceed that with the IPL, and then after the Frax 1940 for enhanced delivery, apply these cosmeceuticals. So really, in conclusion, the Frax Pro is a very sophisticated, great non-ablative fractional laser. We have 2 different handpieces corresponding to 2 different wavelengths. The 1550, which corresponds to the wavelength of 1550, is what we use for dermal issues such as scars, rejuvenation, stretch marks. The 1940 is the one that's more for surface. So it's basically, it's a microscopic epidermal ablation, but without the downtime of the crusting and the oozing that we used to have, for example, with the CO2. So it's good for glow, tone, and texture. And with that, I'd like to thank you all and hand it back over to you, Dr. Patel.
Oh, thank you. Thank you. That was wonderful. I have a question. Do you have any favorite post-procedure regimens, especially as you're treating some of these non-ablative treatments?
So, well, I mean, that really depends on the treatment that I'm doing, if it's just rejuvenation or scars. But in essence, without mentioning specific brands, you want to hydrate the skin, you want to protect the skin. So there's definitely the sun protection. There's definitely the serums and the creams that hydrate the skin, but also support the barrier of the skin. So I like to use sun protection, serums and creams to strengthen the barrier and hydrate the skin.
And
were you looking at a specific condition, for example?
So for pigmentation, for example?
Yeah. So for pigmentation, I really like the combination of the antioxidants that particularly contain a vitamin C serum and tranexamic acids. I also, I use one that contains tranexamic acid and glutathione and vitamin C. So I have all three in one. So after the Frax 1940, I apply that on. It's going to be more absorbed, and then I give the cream form of that to the patient to use daily afterwards.
Very nice. Well, with that, I think we'll turn it over to Dr. Cordula.
Thank you, Konica. Yes, so sunny greetings from Mallorca, from Spain. And I would like to introduce to you some protocols that really changed our clinic. So we have wonderful results with that, and we really pleased our patients. So, and I would really like to share them with you. So, as you probably know, as dermatologists, we have to deal with a lot of acne cases. So, acne is one of the most common skin condition worldwide, and there's a lot of treatments that people get recommended. I mean, influencers are not always helpful here, so people usually come with big bags of tons of creams, and so it's our task actually to diagnose the right type of acne, and then to explain to the patients a proper treatment. So as we know, acne is an inflammatory disease which requires a proper treatment. So topical care does usually not clear acne, and what we have established in our clinic is a combination of the PR 530 with the Frax 1550. So we start from the first visit of the patients with this combination, and we really have very good experience with this. So what is the PR 530 doing? We reduce the inflammatory component of acne, so it's anti-inflammatory, it's reducing the activity of the sebaceous glands as well. We have a good effect on the porphyrin of the bacteria, and patients really experience a very fast response to these treatments, which makes them stick to it and come back for the next one, even though it's a little bit uncomfortable. And at the same treatment day, we use the Frax 1550, which is, as we just heard from Professor Piras, is working in the depth of the skin, so in the dermis, and there it can induce collagen remodeling, and it improves the skin texture. It also treats scars and prevents scarring here. And so we have this simultaneous protocol, which really improves not just the inflammation, but also the texture of the skin. So how do we do this? It's pretty straightforward, pretty easy. So first we start with the PR 530, usually with quite low settings, so 7 to 8 joule. We do this with our topical anesthetic. And after that, we apply the anesthetic for about half an hour and do the Frax 1550 then. So I will show you how that works. You will see a small video here. Yeah, so sorry, this was the anesthetic cream, but usually we do it without. So first we apply contact gels, so then PR 530. And you see this nice ice roller, which is really helpful for patients. And then we apply the Frax 1550 with the 3 passes. So here you see a V&A picture. This was a patient who underwent 4 sessions with PR 530 and Frax 1550. He's been treated additionally with isotretinoin. As you can see, he suffered from a really deep acne type. And so he was on 20 milligrams per day over 4 months. And the skin really showed a very fast improvement after this treatment, after this combination. That's another case. He came from a different clinic. He was put on a monotherapy just with isotretinoin 20 milligrams a day and didn't see much improvement. He was unfortunately advised not to use any laser treatments. I think this is still among a lot of dermatologists and skincare specialists, a common opinion. So I think it's really time to overcome that. There have been so many papers now, scientific papers that have shown that there's no problem to combine lasers with isotretinoin. So we don't see any complications. Just be careful with CO2, but any other lasers can be easily combined, with isotretinoin. And you see after just one result, after one session, we have this significant improvement on his skin. So why do patients benefit? Well, they see faster healing progress. So we deal with young patients, they are not the most patient people, of course, they had their pimples, their acne every day. So they ask for fast treatment solutions, and this protocol really works well for that. And we personally in our clinic do not do any deep cleansing procedures anymore, because we find the laser a lot more sufficient, a lot more fast, and the outcomes are very, very well. And of course, for us as practitioners, it's also great. We are private clinics, so our goal is always to have happy patients. These, of course, they're recommended to their friends, to their families, and so that makes us happy too. And I must say, it has been a real game changer since we use this protocol. So we have faster treatments, faster results. And of course, what comes along with that is a higher profitability as well. Yeah, so take home message for you. Please combine SVT with Frax 1550. It works very impactful. It's reliable, and there's no complication, even if you combine it with systemic isotretinoin. So another topic I deal with every day, as you can imagine, our patients, they love the sun, and they suffer from chronic sun damage and a lot of actinic sun damage as well. And so here it's not just a matter of aesthetics, but also of medical problems. So I think as dermatologists, we really have to deal with the health, with the skin health, and to maintain that, and to repair the skin to a certain degree. And therefore we use Nordlys and the Frax devices. So they are very helpful in this task. Yeah, what is the aim? So, of course, to turn back the clock. As we all know, this works a little bit and more because we have more and more tools to do it. So we want to prevent skin cancer, which means we have to treat and diagnose actinic keratosis and not ignore them. And also when it comes to aesthetic procedures, I think it's very important to focus on the evenness and on the radiant glow as well, because that's always part of our beauty. And also, I personally find I'm doing a lot of filler treatments in the clinic, and we use lots of collagen inductors. I'm sorry, but I find a very well maintained and radiant skin, only enhances those treatments well. And if you don't do that, it doesn't really come along, and it doesn't show a good harmony. So again, here, what our protocol is in many patients is we work in a multi-layer approach. So we use the VL and PR to reduce pigmentation and to address vascular changes, which is usually part of the photo-aged skin. And simultaneously, we improve the skin texture and the glow by using 1940, or we address the collagen tissue, by using the Frax 1550. Yeah, but this is in our clinic usually common procedure to combine those two or even those three devices. So I would like to share with you some cases that we did. So here we see a décolletage. This is, of course, also an area of the skin which is sun damaged and which most of women would like to treat from a certain age on. So we did a first session with VL and combined in the second session after 4 weeks with the VL and 1940. And you see not only the improvement in pigmentation, but also when you touch the skin, it's really, it feels a lot more smooth. It feels really, all the irregularities disappear. So it has a lovely appearance afterwards. And in this video, I would like to show you, as you can see, this lady, she suffers from quite strong photoaging as well. She's only in her late 40s, but she looks a lot older. If you look at her skin, and we treated her with, you have to press again, yes, so we treated her with the PR first, so to address pigmentation. Yeah, so this is the first part of the treatment, and the second part here is done with Pico laser, with the Picoway Resolve 1064 to stimulate collagen. So that's also a lovely combination that we do a lot, and you can see here on the right side the after picture, which has been taken after a year, because I haven't seen the lady in between. She couldn't afford any other treatments, so she just had one session of these treatments done with a really wonderful outcome. So here we see another lady where we did what we call a 3D rejuvenation. This lady has never done anything before. She's in her 50s. She's never done any fillers. She was afraid of an unnatural look. So I had to promise her to be not too aggressive, and we combined in the first session Frax 1940 with some collagen stimulator and a little bit of HA filler. So we did what we call a facial framing on the jawline and on the cheeks. And the second session was after 4 weeks with PR. We did a little bit of lip hydration and chin remodeling, and this is the result just after 2 sessions. Here's the same lady in the from the frontal view, and you can clearly see the improvement of the texture of the skin, which you could never achieve just with injectables. Yeah, so the combination of the two of injectables with lasers really make the difference. Yeah, and this is my take-home message for you. 2D multi-layer, yeah, is something that we should use if we have this wonderful device, Nordlys. So don't be afraid. It's something that you can easily combine in one session with a wonderful outcome. And 3D rejuvenation for me makes the difference. So this is combining the lasers and EBDs with injectables, and I think this is where the future goes, and yeah, I'm excited to work there even more. So just another two more words to Nordlys and Sun. We already talked about it. SPF 50, I think, is essential for all patients. I mean, this is crucial. I personally don't treat anyone who is not who's not using a high sunscreen. Not just because of the safety of the lasers, but also, I mean, we want to maintain our collagen as good as possible, and the SPF 50 is the main part for that. Yeah. So acne treatment we treat all year round without any problems. Of course, with the same advice, patients have to use oil-free sun protection, but otherwise we never stop in the summertime and have no problems. Caution with pre-tanned patients. I had even a type 1 patient 2 days ago who hasn't told me that he's been in the sun before, and treated his lentiginous with PR 530 on the hands, and I burned him a little bit. So really be careful with pre-tanned patients, even if they are not dark skin types, so even on the lighter ones. And we are much safer to use VL than instead of PR if we have to deal with tanned patients. Yes, thank you very much for your attention, and I'm looking forward to your questions.
Thank you so much, Cordula. Those are really life-changing treatments for these kids. So it's really wonderful. Tell us a couple of things. We've got some questions regarding how you incorporate the antibiotics into treating these acne patients.
I usually don't use antibiotics in acne patients. So we use isotretinoin. We really educate our patients in skincare. I think this is really important, to use a good cleanser, to use products based on glycolic acid, salicylic acid, things like that. But personally, my standard protocol does not involve any antibiotics.
And at what point do you start the energy-based devices, the Frax and the 1550? I'm sorry, the 1550 and the SWT applicators.
I must say, I really start on the first day of the visit. Yeah, so no, we always, and also in younger patients. I mean, we see more and more young girls, in the age of 12, who already start suffering from early acne. And I don't wait with the treatment, so I really start early.
And with the darker skin types, the 5s and 6s, I'm assuming you really generally stick with the non-ablative fractional applicators, or I'll ask the entire group there, as opposed to the SWT applicators. But let me open up that question to everybody in terms of their experience.
You might have more experience with 5 and 6. I personally don't have so many in our clinics with the very dark skin types.
How about you, Firaz? What are your thoughts about 5 and 6? Mm-hmm.
Are we talking about acne?
We're talking about acne, yes. Acne and acne.
For the 5 and 6. For the 5 and 6, if I use an energy-based device, I would use the microsecond Nd:YAG of the Gmax. So the microsecond Nd:YAG is much safer than the PR, and there are numerous publications on its use, and that's the wavelength that I would use. So as we know, the Nd:YAG is safe even in skin type 6. And I will use it in the microsecond mode. So that's what I would use if it's an acne in the skin type 5 or 6. I wouldn't use the PR. As with the 1550, yes, I use. But I will alter the parameters, which means low density, fewer passes, cooling in between, cooling afterwards, topical steroid for a few days, and then longer intervals in between.
Yes, and I think Diala, you do something very similar with your skin type 5s and 6s with the Frax applicators, correct?
Definitely agree with Firas.
And now, what about 1940?
Well, 1940 is not the wavelength for acne. For very superficial acne scars, you can use it. You will combine it with a 1550, so it can work for the very, very small superficial acne scars. But the 1940 is generally very safe, even in the very higher skin types. Again, it's just looking at the interaction and using relative lower densities. But even the skin type 6, I have used in 1940.
Great. Well, thank you.
I think there was a question about the antibiotics. One of the audience attendees asked about antibiotics and comparison. I think we are, in general, as dermatologists, and this is becoming more apparent in the discussions among the experts and conferences, we are moving away from traditional long-term systemic antibiotics because we now understand the importance of the microbiome, the gut microbiome, and its importance in terms of maintaining a good immune system. So this 6 months broad spectrum antibiotics, killing all the microbiome to just improve on the acne, this is something very much of the past. And actually, even younger patients who come and see us, they're very much aware of the microbiome and the gut health. And they themselves say, I do not want to have antibiotics. Actually, I can't remember when was the last time I prescribed antibiotics. I agree with Dr. Cordula. Isotretinoin is different, and I do use isotretinoin, and I use it in combination. But antibiotics orally, that is becoming really something very old-fashioned in the management of acne, because when you balance the pros and cons against the microbiome, it's really not worth it.
That's all great information. Thank you, everybody. And we have our final speaker this evening, but certainly not least. So we have many, many wonderful things to hear from Nicola, from Dr. Dermac. I think his screen is still frozen. So just the audience, you're going to listen to his voice as he goes through all of his wonderful treatments. And he's going to talk about elevating results in scar management and photorejuvenation and the combination treatments of 1940 and other treatments. So thank you so much, Nicola.
Thank you. Well, we're going to be fast because we are run out of time.
We're good.
So my topics is on Frax 1940. So I must say that this laser was a huge surprise for me. I bought it just because a friend of mine told me during the development of the handpiece. He told me that these things work very well on improving aspect of enlarged pores. So there is no so many things on the market that work so very well on this argument. So I bought it only for that. But as soon as I began to use it, I noticed great results on the texture of the skin, on the shining of the skin. The skin became smoother. The pigment, it uniforms the pigment. So this laser, that's why I put the title of this topic, Unleashing the Power of Frax 1940, because I really believe that this laser is one of the most underappreciated and undervalued devices in its category. But before we begin to speak about how I use the laser and the results that we can obtain, just for job, let's imagine for a second how should be a perfect laser. It will be definitely without collateral effects. It will be a laser that is extremely easy to use and that everybody can appreciate results, that can be suitable for use from 20 up to 8 years. With minimal downtime, painless procedure, rapid in its execution, and of course, it doesn't have to cost a lot. It's a kind of Walt Disney laser. Let's leave this slide for the end of presentation. So, why this laser gives such nice results and such a large spectrum of skin conditions? I don't know, but during these years, I always like to change the parameters. I'm always looking for something different. With these lasers, strange things happened. After 3 years, I fixed myself on same parameters. With energy, I'm on 10 millijoules, 3 milliseconds of pulse duration, and I noticed that the most important parameter on working with this laser was coverage. Now I'm working stably on face with 50% and on the body with 45% during the 4 passes on the face and the body, and only in the very difficult skin condition like the bad texture we use to do the 5th passes also. So why this laser works so well, I try to understand it, and I would like to share with you some of my ideas about it. This is, as Fira showed before, this is the histology of the microthermal zone of Frax 9040. As we can see, we are very superficial. We are working here in high papillary dermis and basal membrane. So we are with depth on maximum 200 microns. This publication here makes me think a lot because the authors, they measured the level of neocollagenogenesis using Frax 1550. And one of the conclusions was that the depth was the critical value. So they obtained the best results, keeping themselves high, very, very high, from 100 up to 400 microns. So what happens on these levels? We all know that the main source of dermal and epidermal pluripotent stem cells are the bulge, but the bulge is too deep for Frax 9040. But all other skin stem cells are located in the small niches which are present exactly on the level where we work. So I'm convinced that the stimulation that we give on this level in the middle of stem cells allowed us to obtain results on such a large spectrum of skin characteristics. The other extremely nice characteristic of Frax 9040 is that it can be combined with everything. So I normally use it with pulse dye laser as a protocol when I treat melasma, in photorejuvenation also. And also when we have the problems with thickness of the skin. With Pico, when we have to treat lentigo or freckles. With bimotoprost, when I have to treat some hypopigmentation. Or with gentle lace, with alexandrites, long pulse, in other kind of pigmentation. So let's see some results. This is one single session for freckles, Pico and Frax 9040 together. Now, let's forget for a second the freckles. Okay, they went away. But look, the appearance of the skin of this patient. And we are talking about 25 years young patient. So it is not easy to improve the skin in such a young patient. But look here, there is improvement. This is an older patient with some small seborrheic keratosis together with gentle wax. Leave away, let's put away the keratosis. Look the texture of this skin. Together with Frax, pulse dye laser and Frax 9040 in case of enlarged pores and underlying rosacea or diffuse redness. Only one session. Now, I will not talk about actinic keratosis and Frax 9040 because we all know that Frax 9040 has FDA approval for actinic keratosis. I would like just to say that it is much easier to treat large areas of actinic keratosis with Frax 9040 than normally we use a 5-fluor uracil. But with 5-fluor uracil, we have kind of 2 months of diffuse redness in the area that we treat. With Frax 9040 in 2-3 sessions, we obtain great results with 1 or 2 days of redness after treatment. So this is one single session on treatment of melasma, together with pulse dye laser. Post-inflammatory hyperpigmentation in dark-skinned patients. It's a huge problem because it's not easy to treat it. This is 2 sessions with Frax 9040. Okay. Texture. As we said before, great results on a texture. Here we have the measurement of enlarged pores, reduction in one single session. Look what the nice results we can obtain. Now, playing with this skin analyzer, I noticed that independently of the level of porphyrin on the face, after treatment with Frax, we have reduction of porphyrin levels. Now, we know that porphyrins in skin can be found in melanocytes, in sebaceous glands, and in hair follicles. And the importance of porphyrin, it's acts as cofactor in some enzymes involved in melanin synthesis. And I don't have to speak about the importance of porphyrins as a pro-inflammatory factor in acne. So look the level of reduction. I mean, we are going down from 72 to level percent of porphyrin. Now, this could be the second reason why it works so well in so many aspects of skin, because we work on porphyrin, which has a role on melanogenesis, inflammatory process and acne. And in photorejuvenation, we know that photodamaged cells link porphyrin with higher affinity. Something happened there. Here we have improvement of comedonic acne a month after one session of this is without any treatment. That's why I put the picture. Only Frax, one session without retinoids locally. About the scars. Now, we know for each kind of scar what lasers have, or combination of lasers to use. But what we can do on white scars. So there is lots of publications on use of bimatoprost together with Frax 1550 and CO2 fractional laser, where these lasers are used as delivery for bimatoprost. I began to play with 9040, and results are nice. Two kinds of results. First, the scars lose its white appearance because there is some neoangiogenesis, and this result is almost guaranteed. So we lose this white appearance, and it became a little bit red. And sometimes, without any rule, so I'm trying and trying, we have also the repigmentation, the compression of new melanocytes. I used to put the bimatoprost in occlusion for 20 days after the Frax treatment. Here, Firas before spoke about the scars and the Frax 9040. Now, Frax 9040 doesn't have any indication for scar treatments, for acne scars treatment, but I noticed that this small, very superficial, just as Firas said before, these small superficial box scars obtains really nice results. And it's not easy to treat these superficial scars, but this is what we obtained. Now about our Walt Disney laser. I use this laser, it's been now 3 years, more than 3 years. And as I said before, I use it more than 8 months a year. We have about 3 up to 6 treatments per day. This laser is together with the two GentleMax Pro, the treatment that we use more in our clinic. And until now, I didn't have not one single collateral effect. And I put every parameter that was possible to use. It is extremely easy to use it. I changed several operators in my clinic in 3 years, and it is enough to treat 2 faces to obtain a good level to make a good treatment. It can be used in every kind of face, as you see before. Even 25 years young patient obtains nice results with this laser. Everybody appreciates it. It's really difficult to have the patient that came back and says, look, I don't see the results. Downtime, we are talking about 1 single day of light redness. I went out on the dinner with a patient that do the treatment in the afternoon. Pain-free procedure, it became pain-free procedure if you use the Zimmer or after 30, 45 minutes of local anesthesia that we use normally. It is very fast as a procedure. I mean, the procedure is, we need about 15, 20 minutes to do the full face. And about the cost, I have to say that among all Candela lasers, this one is the less expensive, so it goes well. That's it. Thank you very much for following.
Thank you very much. There's so much here, and all of you have covered a wide variety of applications, and you're right. The Nordlys can do so many different things that it is sort of like keeping everybody happy at Disneyland. That's a great analogy. Does anybody have anything that they want to add for the audience? I think we answered our questions along the way, and I wanted to make sure that we got them answered for all of the speakers. So is there anything the panel would like to add? What one question Dr. Firas, you're on mute.
No, sorry. No, it's fine.
No.
I think we can take the questions fine.
Great. One of the questions is, what about cooling, and does that affect the quality of the 1940 treatment?
No,
it doesn't.
Not at all.
No, the cool. In fact, you can add in cooling, and I mean, I know in some clinics they add in extra cooling, and it will not affect at all. No, we're creating coagulation in the skin, so there's no effect there. I think there's a question to me.
Yes. It's about the modality suggested to treat pigmentation in intimate areas, also in areas like the underarm, and for darker skin types in particular. What do you think?
Well, I mean, in those areas, I like to use the peak away. It's less painful, and you can go faster with the repetition rate. So I usually, in those areas, I combine the pico with a chemical peel. So I use a glycolic or a TCA, but I use a specific type of TCA that doesn't frost there in that area. But if you don't want to use a peel, the peak away would be my first choice.
And has anybody used the 1940 for hyperpigmentation?
I have certainly used it for facial acanthosis, because for bitemporal facial acanthosis, the peak away doesn't really cut the mustard, and that's because it's pigmented keratinocytes and the skin is a bit thicker. So for facial acanthosis, using the 1940 together with delivery of cosmeceuticals, that works well. So for acanthosis, 1940, but for pure pigments, I still use I use the peak away.
And let's talk a little bit about CO2 versus 1550. What do you think?
Oof.
Well, I mean, I think, well, first of all, downtime and skin type. So definitely for the skin type 5, if we let's take a skin type 5, okay, which is a challenge for many. I mean, you'd be really risking it with a CO2. So you have a higher safety margin with the 1550. But so it's downtime, it's risk. And also, I don't know about where you work, but where I work, many patients don't want to have the downtime with the CO2. So I think for very, very deep wrinkles, severely photo-damaged skin, lighter skin type patients who are willing to have the downtime, you can have that discussion of the CO2. But for most of the patients, for practical reasons and for safety reasons, I tend to use the 1550.
Any other thoughts?
Yes, we can put it practically. I mean, what is the percentage of people that can stay home 7 days after CO2?
Exactly.
And what is the percentage of people that can stay at home 1 day, or they put makeup and they go work the day after? An example, in my place, we do maybe 2 CO2 resurfacing per month, and we are doing about 5 Fraxes per day.
Yeah.
This is difference.
And certainly the post-erythema is a completely different situation.
No, with Frax, with Frax, you don't have the problems. With CO2, you have your mind on patient for next the 10 days. It's completely different.
No, I agree. The CO2 has become less popular for
yes,
this.
yes.
It's mostly for lesion removal. Using just the handpiece to remove lesions.
Scars, kind of.
But yeah, most are using now the non-ablative fraction.
And then when we speak about scars, the CO2 is used in all kinds of scars, but Frax works even better in atrophic scars. An example, if you have to treat the stria, the white stria, Frax is indicated much more than CO2.
Yeah.
And one final question. Let's just review the latest, and it's been many years now with the two consensus papers that have come out. Firaz, would you like to address isotretinoin therapy and energy-based devices?
Yeah, thank you. Well, one of the papers I wrote, or co-wrote, shall we say. Well, I mean, look, it is safe. That is the take-home message. It is safe. There are numerous papers now that show the safety of non-ablative lasers. So that is your pulse dye laser, your IPL, non-ablative fractional, even the fractional CO2. But of course, the more aggressive you go with the treatment with the ablative CO2, so I'm just talking about the ablative CO2, you may want to look at how dry the skin, skin fragility. But for all the treatments that we mentioned today in this webinar, so the 1550, the 1940, the IPL, the pulse dye laser was mentioned, it is safe, and certainly safe for the lower doses that we are now currently using, the 20, 30 milligram. There are a number of papers. There's a paper, isotretinoin and microneedling radiofrequency. There's a paper of isotretinoin and pulse dye laser. There's a paper on isotretinoin and IPL, because I saw there was a question asking if it's only the IPL and not the laser. No, it's both. IPL and laser, both of them are safe with isotretinoin. So I think this discussion is now truly over, and most dermatologists are well aware of this. Or they should be.
Yes.
Do you have anything to add on isotretinoin? Do you have a view on isotretinoin and laser treatments?
Sorry, who did you ask?
Yeah, Dr. Konica, do you have a view on isotretinoin and laser treatments? Or?
No, I agree with the consensus papers, and I follow the new guidelines. And many of, I will say that many of the old user manuals still have that in there, and that is something that is listed because it's it's an older manual, and that is based on the submission at the time. But as we're rolling out new products and as we're submitting new manuals to the regulatory agencies, we have removed that as a contraindication.
Yeah, definitely.
Based on the science, absolutely. Well, I want to take a minute then to thank you all. This is always such a pleasure to learn from you, and thank you so much for sharing such wonderful cases. And I also want to thank, on behalf of all the team at Candela, the audience, for staying. We're a bit over, but I hope that this was useful and enjoyable. And until next time, please have a good evening.
Thank you.
Thank you. Bye.
Bye.
Bye. Bye.
Bye.